Hey guys, welcome and welcome back to another video. So guys, if you have not subscribed, kindly subscribe, like the video, share, comment. Don't forget to turn your notification bell, and the most important thing, make sure you watch this video up to the end. So today we want to talk about what are the causes of penis to shrink, or what causes penis shrinkage. Yes, so your penis may shrink due to aging, number one, health condition, obesity is not left out, or maybe prostate surgery. So I want to say this. The length of your penis can decrease by up to an inch, or for various reasons it can reduce for maybe 1.5 inch. Usually changes to penis size are smaller than an inch. However, it might be closer to an inch or maybe less. Yeah, so let us look at the causes of penis shrinkage. Number one is aging, number two is obesity, number three is prostate surgery, number four is the curving of the penis, and it is known as Peyronie's disease. Peyronie's disease, Peyronie's disease. I don't know if I'm pronouncing it well. So let us discuss how aging is bringing this problem. So as you get older, your penis and testicle may get slightly smaller, and that is obvious. Even with the ladies, there are so many things that usually shrink in their bodies. Yeah, we will talk about that in the next video. So this is an obvious statement that as you get older, your penis and testicle usually get smaller. So one reason is the buildup of the fatty deposit in your arteries, reducing blood flow to your penis, and this can cause withering of the muscles and muscle cells and in the spongy tube of erectile tissue inside your penis. And also with aging, the skin wrinkles, the collagen loses its strength, the muscles become atrophied. So obviously as you age, the size will reduce a bit. Okay, let us talk about obesity. Obesity is also another problem that usually set in, and it always does bring a lot of problem related to health. If we look at diabetes, obesity is one of the cause, hypertension is one of the cause, or obesity causes hypertension, and many others. So if you gain weight, particularly around your belly, the kitambi people, those who love kitambi, if you gain weight, especially around your belly, your penis may start to look shorter. That is because the thick pad of fat starts to envelop the shaft, start to cover or envelope is like covering, yes, start to envelope the shaft of your penis. So when you look down at it, your penis may seems to be have gotten short. And in men, you have in men with extreme obesity, fat can enclose most of the penis. Another thing that we had stated was the prostate surgery. Yes, prostate surgery. And we were talking about prostate surgery, and we get that about 70% of men who experience mild to moderate shortening of their penis after having a cancerous prostate gland removal, and the procedure, we know it is called prostatectomy. So most of the time after the surgery, the doctor will recommend abstinence for some period of time, and you get, during this period of time, you will not, you will experience at least the penis will reduce in size. Yes, the penis will reduce in size, of course, because there is no blood supply at that point, because with sex the blood gets supply to the penis, and it helps the penis to stay healthy. So after the surgery, you may be given an amount of time to rest or to abstain, and this time the blood will not exactly, it won't get supplied to the penis, but it will reduce, and with that you will get, after the procedure or after you have healed, you might experience a short penis. We have a disease that is called Peyronie's. I don't know how to pronounce it. Peyronie disease. A Peyronie disease is where the penis develops an extreme curvature that make an intercourse painful or impossible. So if you have a Peyronie's disease, you might have you might not engage in sex because of the sex might be painful, or yeah, that is the most reason. The sex might be, you might, during the process you might experience a lot of pain. So how to correct this? The surgery usually done to remove the tissues or the scars that causes the Peyronie's disease. So how do you treat these things? How do we avoid all these things? Number one, remain physically active. Do exercise, walk, run. Find yourself active, involved in so many activities. Don't make yourself so lazy that you cannot do anything, because you will get a small penis. Number two, eat nutritious diet so that you avoid all these health conditions such as diabetes, which sometimes make it reduce the blood supply to the organ. And another thing is that reduce smoking and alcohol. Reduce, and in fact avoid them at all costs. We usually see that most of these long-term conditions are brought up with smoking and alcohol, and people doesn't get it. Even if you explain to them the side effects of this, of smoking and alcohol, they won't get. They will do what? They will start regretting after getting the condition, after they are suffering from diabetes, hypertension, kidney diseases, is when they will start regretting. Avoid this thing. Smoking, alcohol, avoid them, so that you get a healthy penis, so that you don't get a small penis. We don't want small penis. Yeah. And also avoid consumption of carbohydrates, so that you don't get what? You don't get fat. In short, I'm saying, get yourself a healthy weight, a normal weight. Yes, get yourself a normal weight, so that you also avoid all these health conditions related to obesity. Yeah.